All right, well, thank you everyone for joining today and welcome to NBPHE's Winter 2025 Virtual CPH Review Session Series. My name's Ashley Mueller and I'm the Manager of Educational Programs at NBPHE. We are thrilled to have you here with us to to kick off this series designed to help you prepare for the CPH exam. So throughout today's session, I'll be monitoring the chat. It is open, so feel free to interact with your fellow attendees, say where you're from, put any comments in that you'd like to share with each other. If you have any questions for our presenter today, please submit them in the Q&A section and we will address them at the end of the presentation. So today's session is the overview of the certification in public health, which is presented by Allison Foster, the president of the National Board of Public Health Examiners. Allison brings a wealth of expertise in public health certification and leadership. As the NBPHE president, she oversees governance and operations, including administration of the CPH exam. Allison is based in Arlington, Virginia, and an active contributor to the nonprofit community in the greater Washington, D.C. area. So with that, I'd like to ask you to join me in welcoming Allison Foster.
All right, thank you, Ashley. So I'm very excited to be here and talk to you all today, and I appreciate you taking a little time out of your schedules on a Thursday afternoon. So what I'm going to do today is cover the basics of the CPH examination. We're going to talk about why certification is important, eligibility for the exam. Probably spend a little more time on the actual exam than anything else, because that's usually what folks are the most worried about. But we'll also talk about the CPH community and how to stay certified after you pass the exam. Usually it takes about 45 minutes for me to get through everything. So we'll have plenty of time at the end. So I'm just going to keep going unless, Ashley, I'm not sharing my screen or something, just yell, but I'm going to have my screen in front of me, so I won't be able to see any questions anyways. All right, so let's go ahead and get this started. And there we go. All right, we good? Okay, super. Okay, so we're going to talk about the CPH this afternoon. So want to welcome you on behalf of our board of directors. Our organization is technically based in DC, though we have staff in many different locations. Our board is comprised of representatives of a number of different organizations that I'm sure you all are probably familiar with. We also have a number of at-large members on our board as well. Let's skip that one. So I think what I'm going to do is I'm just going to talk first about why certification. If you're going to go to the trouble of preparing to take a certification exam, then I think it's great if you have a better understanding of why certification is important, particularly to a field like public health. So what I'm showing now, this represents what are commonly thought of as the three foundational parts of any profession. So sometimes we call it the three legs of the stool, but most professions have these three things. So in the bottom right, most professions have degrees. And think about any profession in the health world, any professional you work with. So most have degrees. We do, of course. We've had public health degrees for many, many years. Most professions also have accreditation. So accreditation is basically a peer review process for organizations. So companies, institutions, associations, so people are typically not accredited, but organizations are. And we have that in public health. We have CEF accreditation for schools and programs. We have FAB accreditation for health departments. So that it's not a concept that's new to us at all. But the third leg of the stool that we have not had previously is certification for the field. So licensure and certification are more or less the same thing. There's a little bit of differences, but more or less the same. So certification is for individuals, and it's a process that confirms that they are competent to do their job, that they have the knowledge and the skills needed to do their jobs. So that is what public health has not had. There are a few specialty certifications in public health, but we haven't had one that really brings us together as a field. And that's really what the CPH was intended to do. So just taking a step back. So this is an idea that's been around for a really long time, at least since the 1980. I've got a folder on my desk of white papers and reports that have been written and think tanks. This is an idea it's just been around, and really the reason why is because I think you all will agree that public health is one of the most important fields in the world. We've contributed more to the health and well-being of people than any other profession, and yet public health struggles with being prioritized, with funding, with staffing levels, with being the first at the table in a public health emergency. And so the thought has been, well, we really need to what we call professionalize the field so that public health really stands on its own as a profession. As I showed you in the previous slide, we do have degrees, we do have accreditation process, but we don't have is the process that unifies the people. And no matter what your role, no matter what your title, no matter where you work, there's something that ties us all together and says, I am a public health professional, and that there are standards to working in the field. So this idea has gotten a lot of excitement. The Surgeon General's had calls for certification of the public health workforce, and CDC, and a lot of articles have been written. But as things go sometimes, there's a great idea, but nothing really happens. And people say, oh, we should do this, but it doesn't happen for a while. So fortunately, after over 25 years of talking about this, in 2005, the Association of Schools of Public Health and the American Public Health Association got together and said, we really need to make this idea happen. So in 2005, they created the NBPHE, and its mission is to professionalize the public health workforce through certification. So a short 3 years later, we administered the first CPH exam. And now here we are, and I need to update that slide because it's 2025 now. But here we are, nearly 20 years later, and certifying public health professionals and a lot of other fun things that are going on that we'll talk to you about in a moment. So who gets certified? And I do want to talk about the difference between degrees and certifications. So we do get this question pretty frequently. Well, if I have a degree, do I need a certification? And so if you think about it, most other professions have both, and you don't think twice about that. Just the easy example is it's January, so we're going to be doing our taxes pretty soon, right? So in the accounting world, if somebody has a CPA, they have an accounting degree, but they also have a CPA. It's the same thing. Is what we're doing. Board certified physicians, they have an MD or DO, and then they sit for a board certification exam, and it just is the same scenario. And we could have a long list here, but it's very, very, very common to have both certifications and degrees. They complement each other. They work really nicely together, but they're not meant to measure the same thing. And so, there's a lot of validity to the idea that folks who do have a public health degree can also have a certification. So having a certified public health workforce is incredibly important to the field. It'll really move the field forward. But I'm sure if you're thinking about taking the CPH exam, you're also thinking, well, that sounds great, but why should I get my certification? Why should I put the effort in? So there's so many reasons why individuals get their certification. When folks apply for their CPH, we actually ask, like, what's your motivation? Why are you applying to get certified? And it's really interesting because what we found is there's sort of a scale. So some folks decide they want to be certified because they believe it's the right thing to do for the field. They're really proud that they work in public health and they want to move the field forward. There's some folks who realize if they get their certification that it could help them be more competitive to finding a new job. In some cases, they get pay bumps or bonuses. They might be considered for a promotion. So sometimes there are personal benefits that they're interested in. My suspicion is that most people are somewhat in between. They really believe in the idea of certification and they think it's going to help them professionally. And we actually have a video on our website. We brought some folks who had their CPH into our office and we sat them down. We did not prompt them. We just said, why did you get your CPH? And it's really neat to listen to their responses. So because they all tell a slightly different story. But again, I think it comes across that they're also just really believe that public health is an incredibly important field and they want to show how important it is, and they also wanted to further their careers. So just for the sake of time, just not to show you a video, you can watch your own. After the webinar today, Ashley is going to send you all a link. The video is on our website, but she'll send you a link, so it's easy for you to find. So who is certified? So today we've had over 18,000 individuals apply to get their CPH. And you can see on the right, still the greatest number of candidates are alumni who have graduated with a CPH accredited school or program. And part of the reason with this is because we started with alumni as our only eligibility. And over the years, we've added other eligibility. So over time, these other categories are going to catch up. And in just a moment, I'm going to talk to you a little more about what the eligibility types are. But you'll notice down at the bottom, we've tested candidates from over 95 different countries. So the CPH is not just for the United States, is that we literally test worldwide. And then folks, I couldn't figure out a graphic to show you the different backgrounds, but we've had candidates from pretty much every specialty area in public health, every work setting. It's a very, very diverse candidate pool. And that's actually makes it kind of exciting because again, the certification is what pulls the field together. So no matter what your background is that you have something in common professionally and in your knowledge base with your colleagues, which makes it easier to work together and also makes it easier to pivot if you decide you want to change your area of focus and move to a new job. So a lot of these candidates, we find applications because we have lots and lots of different partnerships. So some folks find us on their own, but a lot of the folks that do become certified have heard about us through a membership organization they belong to, or their employer. We're starting to see a trend where a number of governmental agencies are encouraging their employees to get their certification. So now I'm going to talk to you a little bit about the ABCs of getting certified. I'm going to first talk to you about the eligibility. And then we're going to talk about the exam itself, and then we're going to end with what it takes to maintain the certification. Okay, so for eligibility, so we have several different routes to eligibility, and the reason why is because people come into public health in so many different ways, and so we need to define the paths, but it doesn't really matter if you apply under any of these categories. Once you're approved, it's the same exam, it's the same certification. So our first eligibility is for students and alumni. So any students or alumni from CPH accredited or CPH applicant schools of public health are eligible to take the exam. So if you apply as a student, if you're still in school in a CPH accredited school or program, your school or program would approve whether you've taken enough courses to sit for the exam. And if they approve you, you can take the exam right away. However, if you pass the exam, you would be in provisional status until you graduate. But if you take the exam as an alumni, you can take it right away and you'd be fully certified as soon as you pass the exam. So we also have a category for work experience candidates. And so these are folks that don't have a degree from a CPH accredited school or program. And we realize there's lots of folks in this category. So our requirements are they either have a graduate level degree that is related to public health. And we're pretty open to interpretation, but as long as there's a health component to it, then they can take the exam, but they also have to have 3 years of work experience in public health. And we also have a category for candidates who have at least a bachelor's degree, no graduate level degree, at least a bachelor's degree. It does not matter what the bachelor's degree, and it could be in literally anything, and 5 years work experience in public health. And then finally, our fourth category is we have a category for faculty. So just to make it more clear, the faculty would probably technically qualify under work experience, but we want to make it clear that faculty are part of the public health workforce. So the faculty just have to have a graduate level degree and have been teaching or working for more than 3 years. So again, take a look at our eligibility on our website. You're always welcome to email us if you're not sure how you should apply. That's perfectly fine. We can give you some advice. Again, it does not matter how you apply. Once you are approved, then it's the same exam and same certification. Okay. So the testing and registration process. So we really try to make it easy to apply. So if you go to our main website, mouse over the CPH certification, and then the green button apply now is how you find our application. And it's fairly simple, especially if you're applying under student or alumni, you don't need to upload any documentation. If you're applying under work experience, you do need to upload a resume or CV and a copy of a college transcript. But hopefully those are things that you can pretty easily get your hands on. And again, don't ask a whole lot of questions. We try to make it pretty streamlined. So once you apply, so this is where we're a little different than some other organizations. So once you apply, we try to approve everybody within 2 weeks. If you apply and you haven't gotten a response in 2 weeks, feel free just to send us an email and ask us what's holding up your application. We might be waiting for a reviewer and we could send them a reminder. Maybe we need additional information, but usually it's just the reviewers got busy and we can just give them a little nudge and try to get your application approved. As soon as your application's approved, then we send you a note letting you know, and then within 24 hours, you'll receive scheduling instructions from our testing partner, Measure Learning. So once you have those scheduling instructions, if you're ready to take the exam, you can take the exam within a couple days. You can log in, pick your exam date and time, and then you can schedule right away. But in a lot of cases, folks, maybe it's not the right time. Maybe they're just got really busy at work. Maybe they need to study more. So you can sit on those scheduling instructions for as long as you want. This is one area we're different than a lot of certification bodies that say, oh, you have to take the exam within 6 months, for example. We don't. So you have indefinite eligibility. So if you're not ready, just keep those scheduling instructions and just know whenever you are ready to take the exam, then you can proceed at that time. Okay, so the exam fee and application fee combined is $385. We only have one fee, not an application and exam fee separately. So it starts at $385, but we try to make it as affordable as possible. So we have lots and lots and lots of partnerships. You can find them all on our website under fees and discounts. So many organizations, if you're a member or an employee or you're affiliated with that organization, then you would qualify for a discount, which would bring the actual price down to either $315 or $250. So I've got my fingers crossed for you that you'd be eligible for a discount. So the testing process, we actually test all year long. Years ago, we had Windows and we realized that it'd be better just to have testing all year long. So quite literally, you can test any day of the year. So whatever day works best for you is fine with us. So there are two ways that you can test. You can either test at a computer-based testing center, and I'm sure many of you have taken standardized exams at a testing center. So we have 1,400 testing centers. For the most part, they're open Monday through Saturday. They usually test in the morning and the afternoon. I'll show you a little bit about that in a second. We also test by live online proctor. And in that case, you can test from your own home or your office, as long as you have a private space. In that case, we test 24 hours a day, 365 days a year. So the good news is if you're a night owl and you want to take the exam at night, or if you want to take it really early in the morning because you're an early bird, you can do so by live online proctor. And like I said, I'm going to share a couple more slides on that in a second. no matter how you take the exam, as soon as you submit your exam responses, you will know right then and right there whether you passed or not, which is great. You don't have to wait for a letter in the mail. There's not, any delay whatsoever. So you'll know right then if you pass the exam. Okay, so for the testing centers, what I also wanted to mention is on our site, we have a place where you can search for locations. Because if you decide, no, I want to test at a testing center, it's just so I don't have to worry about technology, for example, or if your computer isn't, very up to date, you might want to go to a testing center. If you go to our website, you can search for exact locations. So in this case, you'd click on like Colorado, for example, it would show you all the cities where there's a testing center. And then once you're ready to schedule, you can actually see the addresses of every testing center. If you're testing outside the United States, you can see that you can also toggle to international locations and scroll through every country, and it'll show you the cities where we have test sites. So for proctored exam, just want to say a little more about that. So the proctored process, we found about half of our candidates go to a testing center and about half test by live online proctor. So what happens is you download a browser that prevents you from going to other websites, which you can understand. We don't want you to do that during an exam. And then you join a proctor via Zoom, and the proctor is a real live person that actually stays online with you while you're taking the exam and can offer technical assistance if you need it. So there are a few requirements to do live online proctor. You do have to have a private space. You can't have, people around. You do need to have a clear space. You can't have notes and pieces of paper everywhere. So they will scan the room, make sure you don't have a lot of clutter. Your computer has to be up to certain standards. So it's got the bandwidth to run the Zoom and access the testing site. And of course, you have to have a camera, mic, high-speed internet. That's for the most part it. We do have some very long technical requirements on our website, but what I found the most helpful thing, if you're thinking about this option, is we have this great video on our website, and this is just a screenshot of it. Watch the video. It very clearly explains what it takes to take the exam by remote proctor. So again, if you're comfortable with using technology and or you're not near a testing center, this is a really terrific option. But please, please, please make sure you watch this video. It'll tell you everything you need to do before you take the exam. Okay, so big build up to talking about the exam. So the exam itself is 200 questions that are given in a 4-hour window. All of our questions are multiple choice and single best answer. So there's no essay questions, and it's just what is the most correct answer. So the reason we mention it's a 4-hour window, we used to say it was a 4-hour exam, but we realized looking at the statistics is that most candidates take the exam in just under 3 hours. Why is that important? It's important because what that tells me is that we give enough time that folks can take the exam and feel comfortable at the pace. So what we're seeing by this average is that people are not rushing up to the end and trying to answer the last couple questions in a hurry. Is that most people have plenty of time to answer the questions, at the pace they're comfortable with, and then they have time left over. So just when you hear about a 4-hour window, I just want to make it clear that it does build in extra time so that you are not rushed. That said, if anybody has medical reasons why you need testing accommodations, then we do have a process you could ask for accommodations such as extra time, and that's all part of our application process. Okay, so we know that taking an exam is stressful. It's funny, I mean, everybody I know has been stressed about it, even the folks that teach public health. The faculty even get stressed about it. It's just human nature. So hopefully this graphic is going to make you feel a little more comfortable and build your confidence. So these are the pass rates for the exam. And it does include the retakes because we do allow for people to retake the exam if they don't pass on the first exam attempt. But you can see that our passing rate including retakes, is well over 80%, which I think is pretty good. So I'm hoping that this will give you a little confidence in your ability to pass the exam. But we also have some tools that will help you there as well, which we'll talk about a little bit later. So yes, again, folks can take the exam if they don't pass the first attempt. In fact, we did not have a limit on how often you can take the exam because we offer multiple versions of the exam at any given time. So if you take the exam once and then you take the exam a second time, it's going to be different questions. And so what that means is that you can retake it multiple times if you think you just need one more try before you can pass. Once you've taken the exam the first time, every attempt is $150. You don't need to reapply. You just need to pay the fee. You get another set of scheduling instructions, and pretty straightforward. But hopefully, after you all go through these fantastic review sessions the next few weeks, you won't need to retake the exam. Okay, so what's on the exam? So I'm not going to go into a whole lot of detail here how we build it, but I think it's important to mention that our exam committee does not sit around in a room and decide what public health people need to know to work in the field. We actually have a very rigorous process called a job task analysis. Most certification bodies build their certification exam this way, where we basically survey people working in the field, and as many as possible, we're saying thousands of people will respond to our job task analysis survey. And what we look at is the tasks that they report they do the most frequently and are the most important to their jobs. And then there's, like I said, there's a whole process that we could talk about at another time, how we build the exam content outline. But basically, we are testing candidates on the tasks, the things that public health professionals do that are most important and most frequently done. So it's really based on real time. It's based on what the public health profession is doing at the time. And for this reason, we do update our content outline about every 5 to 7 years. We just went through an update. So if you're going to be taking the exam in the next 5 years, you'll be taking the exam under this content outline. So a content outline, in other words, is a blueprint. This is sort of a map of what's on the exam. What I'm showing you here are just the domains, the groupings of the topics. And I'll give you a little screenshot of the actual content outline in a little bit. But we have almost 100 different topics on the exam. So this is a nice way to summarize what's on the exam. So if you look at these tasks, you're probably thinking that some of these you're really familiar with. And you might also be thinking there are some that you're not as familiar with. Maybe there are a couple of you taking classes in, or that's actually your career field right now. And there might be some that you think, I've never taken a class on this and I have no idea. So the good news is that our passing score is based on the overall score, not each domain. And I think the takeaway here is please don't let I'm going to go back for a second. Don't let one domain intimidate you, and just keep in mind the domains, most are worth 12% of the exam, which means the rest of the exam is worth 88% of the exam. So really look at this holistically and absolutely focus your studies on the domains where you don't have a really strong background, but don't let one domain that's really worrying you stop you from taking the exam, because our passing score is based overall. We don't have a passing score for each domain. And one little fun testing tip here is we do not penalize for wrong answers. And what that means is when you're taking the exam, if you see any questions and you think, I have no idea what the answer is, just pick an answer, because at least you'll have a 25% chance of getting the answer correct. If you leave it blank, you have no chance of getting it correct. So it's a very valid option just to guess if there are any you do not have any idea what the answer is. There are exams out there that penalize for wrong answers. So I just want to clarify, we're not one of those. So your best strategy is to answer everything. Okay, so you got a little taste of what's on the exam. You're going to be going into a lot of detail on all this over the next few weeks. But I'm going to give you sort of a high level overview of how you might approach your process to prepare to take the exam. So first of all, if you're eligible to take the exam, it means you have work experience in public health and you possibly have academic experience in public health, which means you're bringing a lot to the table. You're not starting from scratch. We don't expect anybody to learn everything when they're preparing for the exam. We believe you walk in with a lot of the knowledge and the skills that you need to pass the exam, but there's going to be some gaps. You might need to brush up a little bit. So think about the exam preparation as brushing up. You are absolutely not doing all the work when you start studying. You're already partway there. So just keep that in mind. So we have a number of study resources available. So I'm just going to walk you through some of these. These are the types of resources. Everything that we're aware of is on our website. Some we offer, some partner organizations offer. There might be other things you all know about that we don't, but we're going to talk to you about what we have available on our site. So the first, our study resources page, which you can easily find on our website under the CPH certification section. The top half of the page is self-assessment. And the idea here is we're trying to help you figure out where do you need to study? What are your strengths? What are your weaknesses? What's your study process going to be? And so we have tips for studying, a place for you to start and think about, okay, how am I going to go about this? We do have our content outlines, sample questions, which I'm going to show you in a second. But I also want to mention at the bottom, we have a personal action plan. So if you feel like you just need to write down the process so that you can stay, true to it and get through the process of preparing for the exam, definitely take a look at the personal action plan. So our content outline, and I alluded to this earlier. So our content outline is basically a blueprint of all of the topics that are on our exam. So every question that's in the exam must relate directly to one of the tasks in the content outline. And so this is just a screenshot of health equity and social justice. This is one of our domains. So that's the group, but the tasks themselves, the topics are, you can see below, and they're fairly detailed. These are specifically the things that we expect CPH candidates to know, and every question has to relate to one of these. So the content outline is pretty long. It's about 4 or 5 pages, so I can't show you the whole thing, but what I suggest you do is take a look at it and just scan it. You can print it out if you want and make notes, but honestly, just scanning it, I think is going to give you a really good sort of a gut check of which domains are you familiar with, because you're seeing the detail of it, not just the words health equity and social justice. You're seeing what do we actually mean. So just scan them. There's some you're going to say, oh yeah, very, very familiar with this. And then some you're not. And that I think is a really good early indicator where you might need to study. So we do have some sample questions in a PDF format on the website. It's not many. It's not meant to help you assess your strengths and where you need to prepare. It's really so that you get a high level idea of how the exam questions are written. So just take a quick peek, and so understand what our exam questions look like. But then once you're really ready to get started, we have 3 online practice exams on our website. So they are, I think, a really terrific tool to figuring out your progress and preparing for the exam. So the practice exams, sort of the background of this slide, this is what it looks like. And it looks very similar to the actual testing environment. So one, you're going to get used to the navigation, what it's going to feel like to take the exam. And we have a timer if you want to time yourself. The questions are go through a really rigorous process in our practice exams. Some of them were actually used on the exam, have been retired. They've all gone through the same review that our actual exam questions do. So they're good quality items. And I'm going to say they're probably the best reflection of what the exam questions will be like. They won't be exactly the same. We can't have our real exam questions on the practice exam, but they're a very good reflection of what the exam should feel like. What's really neat about our practice exams is that it gives you an assessment how you did on every domain, whether it was a possible strength, whether you did satisfactory, which is still good, or whether it was a weakness. And so if you take a practice exam and you had a lot of weaknesses, that means you really probably have a lot of preparation to do. If you only had a few, or you had all strengths and satisfactories, you're probably in pretty good shape. And as public health professionals, I'm sure you all understand that there's, correlation between how you do in a practice exam and how you do in the real exam is probably pretty close, but it's not a 100% predictor. So just a kind of a word of caution, but I think it's a terrific tool. So what we suggest, and do whatever works for you, obviously. But what we found a lot of folks have had success with is take the first practice exam. Based on the results, study, go through the process, focus on the areas where you feel like you need to bolster your knowledge, then take another practice exam and then study some more. And then we do have a third one that you can take if you want to keep going. We also suggest don't take the practice exams over and over and over, because after a while, all you're doing is memorizing those questions, which you will not see on the exam, and that's not going to help you. So we suggest you take them once, maybe twice, but I wouldn't take them over and over trying to get your score to be any better, because it's not going to help you on the actual exam. We also have a terrific tool that's new. We just launched this last year. We call it our test prep tool. So it's subscription based. We actually partner with an organization that actually hosts this. We provide the practice questions. You subscribe to this for time period, 3 months or a year. So once you're in the system, it also has practice exams, but you can actually build your own practice exams. So let's say there's 3 domains, for example, where you really need to practice and the rest you're not worried about. So why would you spend your time taking practice questions on the other domains you're not worried about? So in this case, you can actually focus on the domains where you feel like you need to work on a little more. So this is a really unique tool that you might want to consider, especially if you've got specific domains that you're concerned about. Okay, so once you have an idea of where you need to focus, then we do have a number of other tools available for you. That's in the prepare section of our study resources. All right, so the first is webinars. We've been doing review sessions for the last, number of years, probably been 5 years. We typically do record them, like we'll record these, and then we post them to our YouTube page. So we invite you to look at past webinars, past review sessions. It's really, to me, just to watch them, it's really interesting to see how the different presenters present the material in a slightly different way. And so it's not, if you watch more than one webinar based on the same domain, you really get to pick up something new from each one. So they are free, they're on demand. So we encourage you to take a look at these if you're interested. So we do have a couple of different study guides available. So the one on the right, APHA recently updated this, and I need to update the cover. I haven't gotten a hard copy yet, which is why I haven't done that. But the exam review guide is very well done. What's nice about it is, unlike study guides that focus on practice questions, it actually gives you some of the material you need. So there's a chapter in each of the domains. And within each chapter, they give a really robust overview. And then there are some supplemental review practice questions as well. And then on the left, Springer Publishing also has a exam review guide. They haven't updated it yet. They're in the process of doing it. I think if you can get your hands on it, it's worth it, even though it's based on our old content outline, because a lot of the concepts we're testing on really haven't changed. So I think it's still worth taking a look at. And here we are with the review session that hopefully you all are going to be able to participate on over the next few weeks. So just want to give some kudos to Ashley for pulling this together. And the presenters are absolutely fantastic. We are so fortunate to have these folks willing to work with us. So we are really looking forward to the next few weeks. And I think you'll really enjoy it. Okay, so before I go and take questions, I do want to talk to you about recertification, because The CPH is not a certificate. It's, you don't finish, pass the CPH exam, you get a piece of paper and you're done. Certifications are sort of a living, breathing thing. You need to maintain them. They're, show a commitment to the field and demonstrate that folks stay current in their field. Therefore, there is a recertification process. So the summary of our recertification process is CPHs have to report 30 recertification credits to us every 2 years. We have a little portal. They can keep track of their credits and submit their applications. We send out automated reminders. So it's pretty easy to actually do. But what I really want to focus on is how we're different than other certification bodies. Because public health is a different field. We're not medical. We need to do things slightly different to acknowledge just the breadth of the field we work in. So there are two differences. One, the little note at the bottom is actually really important. We do not have pre-approved providers. And what that means is that you can earn your continuing education credits through any organization, as long as the activity meets our requirements as far as type of activity and the topic is related to public health, it will count. We don't see any reason why we should have you go through hoops or why you would have to go through certain providers that we've selected. There are too many providers out there, too many organizations. So any provider is fine. The other way we're different is we don't call it our CE process. So when we say recertification, we mean continuing education and professional development. And there's a big distinction there. And to me, when I think continuing education, I think consuming information, like you take a class, you go through a training, you watch a webinar, you listen to a podcast, you're absorbing and consuming information. Those are all great. Yes, those will count. Go to a conference. Fantastic. But we also acknowledge that public health professionals can grow based on activities that they are putting the work into it. So, for example, if you write a journal article, that will count. If you do voluntary leadership service, like you're on a board of an organization, that will count. If you write items for a CPH exam, that will count. So professional development is a great way to earn credits. And it helps to alleviate the concern that it might be expensive to earn enough credits to stay certified. So it's just 30 credits per year, and it more or less breaks down to 30 hours. So it's not a lot. It's about 15 hours of any of the activities that count. So just keep it in mind, once you get certified and you start thinking about your recertification process, if you think, oh, this is going to be really hard, please call us or email us or something, and we'll talk you through it again. We will send you lots more information once you're certified, but let us know and we'll make sure that it's pretty clear what you need to do, because we try to make it very accessible to anybody working in public health. Okay. So again, once you're certified, a lot of great things in store for you. One is that we'll invite you to join our book club. We have a book club. We all have about 2,000 members in it, and we read a book about every 6 weeks or so. And it's just a lot of fun and great way to get to know other CPHs. We have a super active LinkedIn group. It's they post, we share, and then the CPHs that are in the LinkedIn group will also share online. So you'd be invited to join that as well, so you can network with your colleagues. We have last year started hosting what we call our Webinar Wednesdays. And it's once a month. It's really geared for CPHs by CPHs, and there are cutting edge presentations that we host once a month on a Wednesday. And you'd be invited to those. And lastly, last year we started a CPH ambassador program. So what we found is that there are some folks that are just so excited about being a CPH and they want to share. So we created the CPH ambassador program, and every year now we do a call for applications, and CPHs that want to be able to share, present, help us with social media, et cetera, then they're onboarded as an ambassador. They receive training, and then they're in that position for a year. So, I think I'm actually going to stop there because I sometimes I talk too long and then I don't leave enough time for questions. So I'm going to stop sharing my slides. And then Ashley, if you could let me know what's happening in the Q&A in the chat, that would be great.
Yeah, great. So we do have a couple of questions. I've answered a few of them via text, but I'll start out with our first question, which is one of the most popular. What is the passing score?
I am so glad you asked that question. So the passing score on the CPH exam is a 500. We do have a scaled score. The score can go all the way up to 800, but you just need a 500 to pass the exam.
Great. All right, next one. As far as scoring for the exam, will you be able to know how you did in each section or topic domain?
Yeah. The day after, because our system updates overnight, so the day after you take your exam, you'll get a message from us. You can log back into your portal where you applied in the first place, and you can download your score report, and it'll actually show you how you did overall, but it'll show you your performance per domain. And it's interesting. We found that folks really want to know, even if they passed, they just want to understand what where their strengths are.
Great. If someone needs to reschedule the exam, how would they go about doing that?
Yeah, so they'd reschedule through Measure Learning. So when you schedule, you'll actually get rescheduling instructions as well. If you're far out in enough in advance, then you can just log in and pick another date and time. And if not, you can call or email Measure Learning and they can assist.
Great. I have a couple questions about the global recognition. So is the CPH recognized globally? And if you have the certification, will it help you work in the US?
Great question. So I would say yes, it's recognized internationally. Like I said, we have candidates from so many different countries, almost 95 different countries taking the CPH exam. So it's not just for the US, and we try very hard not to make our exam US focused. We always have members of our job task analysis committee and our item writing committee from different countries just to make sure that it really reflects public health as a whole. As far as helping to get a job in the US, so it's really up to every employer. It's a voluntary certification, but what we have, so there are some employers that require the CPH or prefer the CPH. You know, it's part of their job posting. They'd like to see somebody with a CPH, but there are a lot of certifications out there, and not every employer is going to list every certification, but there have been several different studies done by the Institute of Credentialing Excellence that show employers as a whole like certifications as a whole. And even if they're not seeking a specific certification like the CPH, but when they see a candidate with a certification, they know that means you bring more to the table, that you have demonstrated your competence in the field, that you had the wherewithal to take a standardized exam, and that you're committed to continuing education and recertification. So having a certification absolutely will help you.
Right. So we have another question about eligibility. So is it common for healthcare professionals not to have an MPH, but have the CPH certification?
We do have a lot of our candidates have a MPH because there are a number of schools and programs require their students to take the CPH exam, but we also have a huge swath of candidates do not have a public health degree. So it's not unusual at all. And I'd say they're a good percentage of our candidates. So when we build our exam, that's something that we actually focus on is should somebody that does not have an MPH but does have at least 5 years of work experience be able to answer this question. So we try very hard to make the questions at the right level and the scope so that folks who either have that much work experience or a degree would be able to answer that question.
So there was a couple questions about the recertification credits. So they were just asking, is it 30 recertifications biannually or annually?
Biannually, every 2 years.
Every 2 years, yeah.
So I'd say 15 a year, but you can do none in one year and 30 in another. So that's why we say 30 biannually.
Yeah. And if someone misses a recertification period where they don't submit all their recertification credits in time, what is the process?
We have a reinstatement process. We don't want to lose you. You'd apply to being reinstated. You would have to report makeup credits, but again, it's if you go to, you know, a conference a year, if you publish 2 articles and do one other thing, you probably got enough credits. So we would just have you apply to be reinstated, you report the makeup credits, and then you're in good shape for the next 2 years.
And then somebody has a nursing certification, someone has a chest certification. As far as continuing education credits, could those apply for the CPH recertification credits as well?
Yeah, as long as the topic's related to public health, and the nursing, it would depend, but a lot of them, the topics of those credits would be applicable to public health, that would count. And the chess, I would be hard pressed to think of any example where that wouldn't count. So yes, and we at NBPHE do not mind if people double dip and they report for, one certification and for CPH. So absolutely. So we see a lot of folks doing that, is earning their credits for another certification and then reporting them for ours.
As far as eligibility, does the work experience have to be for all of the domains?
No, no, we actually don't evaluate people per domain. It's truly globally, have they worked in public health? And so if you just worked in one narrow part of public health, which is mostly what people do, most people don't work in all the domains. So if you just worked in health policy, but you worked in health policy for 3 to 5 years, you'd be eligible.
And then as far as the webinar Wednesdays you talked about, are those available for recertification credits?
Yes, they are, Ashley.
I know that answer, huh? And then I did have a couple questions from people about the study resources. So the new APHA book, that is the second edition. And then as far as the Springer book, do we have a timeline on when that will be out?
I can tell you, because I've talked to them, that they're working on it. But they have not told me a timeline.
Okay.
So don't know yet.
Yeah. All right. Let's see here. Oh, as far as equipment for taking like your exam at home, is there specifics on the camera or other computer requirements?
Yeah, we have maybe we could have you shoot this out too, but we have a very technical document that it's a little overwhelming, because I'd say most computers meet the technical requirements anyway. So that's why we try not to make it too in your face when you're looking up what it takes to test by remote proctor. But we do have a list of the requirements. But the other thing is we have, there's a process where you can actually test your computer. And so before you take the exam by remote proctor, the system will tell you if your computer's up to speed. It's pretty unusual that folks can't take the exam. I will mention though, just because we do see this sometimes, you have to have administrative rights to your computer, because you have to download the Guardian browser. If you're using a work computer and you don't have administrator rights, talk to your IT, or you're going to have to find another computer to work on. So if you can't download the Guardian browser, you can't take the exam by remote proctor. Just keep that in mind.
And then I have a couple more questions about the grading. So how is the test being graded? Are there certain points per questions? Or how does the grading for the exam work?
Well, it's no, every question's the same. It is a scaled score. So if you get every question right, it would be an 800. So you don't need to get every question right, obviously, because our passing score is a 500, but it's not a one-to-one match. That's what the scaled score does. So I'm not sure if that answers your question.
And I'll just say, like, we don't grade, you don't have to pass every single different domain.
Right.
It's an
Right.
overall grade. So
Yeah.
yeah. Um, when you're taking the exam, is there a way to flag questions you want to come back
Oh,
to?
sure. Yep, absolutely.
Yeah. And then let's see here. Oh, I do have a question about, does the certification expire?
It does. So after every 2 years, you do need to recertify. And if you don't, we call it lapsed, but you'll lapse and your CPH will no longer be valid. You won't be found in our CPH Certner website. Your digital certificate will no longer work. So yes, it's a 2-year renewal process in perpetuity. We do a way for folks that are retiring to go into CPH retired status so they don't have to lapse. And we've had quite a few retired people, like they're excited they earn their CPH and they don't want to lapse because they retired, so they can sort of a grace status where they kind of close out their CPH account and then they can keep CPH retired after their name as long as they're not working in public health and they don't have to do any recertification.
Yeah. And then how much is recertification?
It's $95 every 2 years.
Okay. All right. As far as when you're taking the exam, or 3 to 4 hours could be a long time. Can you get breaks?
You can have, well, it depends on how you're taking it, but generally speaking, you can have one break. And then if you have reasons why you think you're going to need additional breaks, put that into your accommodations request. But I found that most folks do okay with, like I said, it ends up being more or less a 3-hour exam and a break in the middle. So we found that that works pretty well.
And then as far as fees and discounts, are there any discounts available for the certification application and exam?
Yeah, so we have a whole page on our website. So if you go to CPH credential and there's a pop-up of a whole menu of things you can look at. There is a page called fees and discounts. And I don't know how many fees or discounts we have, but there's probably 50. It feels like a lot. So just scroll through that list. And then what will happen is when you apply, we will ask you which discounts you are, which ones you are eligible for. If you're eligible for more than one, select as many as you wish, but you only get one discount. They don't add on top of each other, and we will just apply the largest discount.
And then upon passing the CPH exam, do you get a physical certificate? And can you put this in your LinkedIn profile?
Why, yes, yes, we mail you a certificate. It's got a little seal on it, a little package information, and a pin you can wear to conferences. And then we do have a digital badging system. So you get a digital badge you can put on LinkedIn. And then if folks click through that, then they will see a digital certificate. So we've got lots of ways for you to share in LinkedIn, your email signature, etc. We want you to show everybody that you're certified. So we try to make that pretty easy.
Yeah. So if someone has a doctorate in healthcare administration, um, and and a, would they be eligible to take the exam?
If they have a doctorate in healthcare administration, it depends. Well, it depends. So if they attended a CPH accredited school, and that's where they earned their doctorate of healthcare administration from, then yes, they'd be eligible as an alumni. If they attended a program and that specific degree was CPH accredited, then yes, they'd be eligible. And if not, then they would just need to have 3 years of work experience in public health. And again, the eligibility, there's so many ways people can become eligible. So we really don't mind if folks just email us and say, here's my scenario. What do you think? That's perfectly fine. We're happy to answer those questions.
Yeah. So if you do have like a specific question on eligibility, I suggest you email the info at
Yeah, absolutely.
nbphe.org. Yeah. Because we can definitely help you better there. Okay, I think that is all of the questions that we have right now today. So thank you so much for being here today, Allison. Thank you for taking the time to present. And our next session is next Tuesday, so I look forward to seeing everyone then.
Thank
Thank
you,
you.
everybody.
Bye-bye.
Bye-bye.